Welcome to the Sisterhood of Limitless Living. I'm Dr. April Moreno, autoimmune wellness researcher and professional helping women around the world to live their best possible lives despite the autoimmune condition. Listen in as we speak on various topics about the autoimmune journey and interview amazing and inspiring women who are living and thriving despite their autoimmune condition. Let's get started. This is a presentation from a recent talk that I gave on the topic of public health, integrative health, and autoimmune wellness. I do a lot on the field of autoimmune disease, both in my research at the university, but also in terms of helping women to live amazing lives. Recently, we had National Public Health Week, just about 2 weeks ago, and I wanted to share some information about public health and what it is. According to Google Dictionary, you're going to find that public health is defined as the health of the population as a whole, especially as a subject of government regulation and support. So public health generally is something that's government funded. It can be national, international, like the World Health Organization, or it can be the CDC here in the United States. It can be at the state level, for example, the California Department of Public Health. It can also be county and city level. A good example, the definition according to the American Public Health Association. They define public health, they describe it as promoting and protecting the health of people and the communities where they live, learn, work, and play. Now known as the Centers for Disease Control and Prevention, but CDC is still their acronym. Public health is defined as the science of protecting and improving the health of people and their communities. So let's talk a little bit about integrative health. I'm a member of the Academy of Integrative Health and Medicine. And this is their definition of integrative health. It is reaffirming the importance of the relationship between practitioner and patient, focusing on the whole person. It is informed by evidence and makes use of all appropriate therapeutic approaches, healthcare professionals, and professions to achieve optimal health and healing. So Academy of Integrative Health and Medicine includes individuals from various fields of health and wellness, various professionals working in either clinical or other settings. And their vision is to establish a new paradigm of healthcare for humanity and the planet. So I wanted to talk a little bit more, taking it beyond integrative health and slightly beyond public health into the field of health, wellness, and flourishing. This article was recently published on the topic of reimagining health and flourishing. And they talk about the concept of reimagining health from simply the absence of disease, but into flourishing. And according to the World Health Organization, 70 years ago, health was defined as a state of complete physical, mental, and social well-being, and not merely the absence of infirmity. It's time for us to really consider health from this perspective without looking at it from a deficit-based perspective of just the mere absence of illness, but actually truly living beyond thought of physical health. So that's where public health seems to be going. That was in an article from professionals in the School of Public Health at Harvard. And so I wanted to go ahead and look at some more directions of public health in terms of the future. So according to the CDC Foundation, public health professionals serve populations by preventing problems from happening or recurring through implementing educational programs, recommending policies, administering services, and conducting research. This is in contrast, they said, to clinical professionals like doctors and nurses who focus primarily on treating individuals after they become sick or injured. I just wanted to say a little bit about this. Public health in origin is related to responsiveness. I would say that public health in its origin was a reactive response to taking control over infectious diseases. Cholera in the well, right, in the water pump is one of the founding stories of public health, the John Snow story. If you were ever to take a class on epidemiology, the study of epidemics, John Snow is going to be in like your first class. He is an individual who tracked down the source of cholera in London to this pump, where to this day the pump still exists. has a monument, and there's a pub on that corner called the John Snow Pub in London. That is a place to go if you want to get in touch with the history of public health and epidemiology. Public health in origin was about disease control. Okay, so it was a reactive response, but now it involves prevention. So it's more focused also on the proactive approach to things. So let's make sure things don't happen. Public health traditionally has, again, been looking at infectious communicable diseases, but one that we don't hear a whole lot about yet is autoimmune disease. So these points are from the AARDA, and it is an emerging public health issue. So according to the NIH and according to the AARDA, there's this various range of prevalence of autoimmune diseases out there. So prevalence is the existence of disease in a population, generally of 100,000 people. When we look at rates, incidence is your rates of new cases of diseases. So what we found here was with the AARDA, they quote this, that the NIH prevalence is only including autoimmune diseases for which epidemiology studies were available. So there are additional conditions that have not been studied to this day in terms of clinical research and effectiveness studies and looking at incidence and prevalence. But according to AARDA, there are over 100 different chronic autoimmune diseases out there. According to the AARDA, autoimmune disease is one of the top 10 causes of death in female children and women. The majority of people who have autoimmune conditions are women. So breakthroughs in autoimmune management, treatment, and care will help autoimmune patients as well as other individuals with immune conditions. And this is straight from AARDA. This is their statistic about who has autoimmune conditions, how many there are out there. There are over 100 at this point. They tend to cluster in families. There's a study out there that talks about the commonality of the mechanisms of 4 most common autoimmune conditions out there. They are type 1 diabetes, rheumatoid arthritis, lupus, and MS. So those tend to have some commonalities in their functions. They tend to cluster in families, and it takes forever sometimes, it feels like, to get a diagnosis. Sometimes you get misdiagnosed, but it tends to take men a little longer to get diagnosed. And again, the majority of people with these conditions are women. And here's an example of some of the diagnoses that are out there, the actual diseases that have been listed on the AARDA website. There are over 100. In terms of research, what's been going on right now at the National Institutes for Health, they're working on the biological processes, treatment, and prevention strategies of autoimmune disease at the moment. I'm really interested more in like the behavioral aspects of these conditions, especially as they affect diverse populations. So that's something that I believe is a growing field of need out there. So autoimmune diseases can attack the body with chronic and debilitating consequences. The causes remain unknown, with no cure in sight at the moment. Disease-modifying drugs are out there, but you'll see this quote in the brochure or in the little drug description that comes with your medication. The exact mechanism for the effectiveness of this drug is unknown. That is something that we'll see pretty commonly. So here I want to talk to you a little bit more about that behavioral research that I'm really interested in compared to the clinical side of research. Clinical is your more traditional research involving the microscope or looking at the genome, the DNA, right? Looking at medication effectiveness. And then also behavioral is how I differentiate the two. I'm really interested in how individuals describe their lives, their everyday living, everyday conditions with medication or without medication, what social support looks like to them, how they've been able to manage their health. Those are things I'm really interested in. So I wanted to share with you a clinical example of these things. Noel Rose, Dr. Rose, is considered the father of autoimmune disease. He's been around for several decades. He was the first one to identify autoimmune disease as a legitimate diagnosis and not just symptoms towards some other diagnosis, like a complication of something related to another disease. But he was the first one to actually say, look, this is something we should look at as legitimate diagnoses in themselves, diseases in themselves. So he talks about the pathogenesis of autoimmune diseases. He's identified those distinguishing characteristics. Sometimes there's some differentiation or there's debate on whether autoimmune diseases, some of them are like inflammatory instead of autoimmune. So there are some variations out there and debates in the literature on which diagnoses or which diseases are actually autoimmune or not. Here, I wanted to talk to you a little bit more about the social determinants of health in public health and what integrative wellness would look like when we connect the two. So in public health, this is a phrase that we use very frequently. It is the social determinants of health because your health is impacted and influenced by so many things beyond genomics or the biological processes. That is a response to other factors. So here, we in public health, in the literature, we have found that economics, your built environment, your community, your neighborhood, and physical environment, as well as education and access to healthy foods, and then most importantly, in my opinion, community support, social support. These are all things that can affect your health, your physical health. So altogether, we look at these things as a whole as public health. All of these different factors are what make up public health. Healthcare systems, hospitals, providers, access to doctors who can speak specific languages, quality of care, coordination of care. These things are all related to public health as a whole. And we look at all of these factors as the social determinants of health. Here I wanted to bring in what the National Wellness Institute has defined as the dimensions of integrative wellness. So we've talked about integrative health and medicine, but now let's take it out a little further to where we're seeing these more specific connections with public health, and it's really fascinating. We look at dimensions of integrative wellness. I've talked about these several times, right? I talk about sometimes 10 dimensions of wellness. These are all different aspects of what we call integrative wellness, according to the National Wellness Institute. And you can definitely see some commonalities where partnerships between public health and integrative wellness would exist. Going back into integrative health, this is where I'm seeing these commonalities and the potential of partnerships across public health and integrative health. To me, I see a perfect match. Let's start with integrative health and medicine. These are all aspects of integrative health. We've got these aspects, which are health access, prevention, environmental sustainability, and collaboration. And I'm seeing commonalities across the two. Integrative health and medicine, according to the Academy for Integrative Health and Medicine, and according to Daniel Friedland, who is a past president of the organization, we see that healthcare is about health. It's health access available to everybody. And then in terms of prevention, this is important to integrative health and medicine as well. It's the foundation. So embracing repairs as needed to the body, right, and to the mind. Environmental sustainability is also something that is prioritized in integrative health and medicine in their culture, practice, and training. From what I'm hearing, one of those examples is like an electromagnetic fields. Protecting yourself from things like that would be in your environment. And then collaboration. AIHM believes in practitioners working collaboratively to heal the mind, body, and spirit. And then looking at commonalities with public health. So health access is something that we also believe in public health. Example, the Affordable Care Act and other types of policy implementation. And I was hired into public health. I didn't know what it was yet, but I was hired to bring in implementation of the Affordable Care Act as that was beginning. So that's health access, public agencies always providing services to everyone in their geographic region. Prevention in public health is about infectious disease, communicable disease, preventing alcohol and other drug addiction, and also making health interventions for things like, for example, type 2 diabetes, hypertension. Environmental sustainability is also important to public health. We look at environmental justice. We look at reducing emissions and diesel particulate matter. Air quality is important. That is something that we see a lot in health disparities research. Traffic safety is important as well, knowing that there's certain areas, certain traffic zones that are not very well planned out. Sun safety is also something that's really important. Sun safety policies, making sure that elementary school kids are out there wearing their hats, their protective gear. And then also food deserts and food swamps are really important to consider. A food desert is a location in a neighborhood that doesn't have access to healthy food, a supermarket, nothing, right? You can't walk to anything. You've got to drive out for miles to get access to food. Food swamps are places where it's like, okay, we've got food here, but we've got fast food only. This is our reality. This is what we see every day. This is what I start to imagine as food. This is, I get hungry. This is where I'm going to go because it's down the street, right? This is your food swamp. And then in terms of collaboration, we're really interested in things like care coordination, working across sectors. So these are things that I've seen in terms of partnerships to work with population health, wellness, and flourishing. Population health has a couple of meanings. In the field of public health, it's your geographic region, population of people in a specific city or county, in your country, right? So that's population health, helping your entire geographic region that you serve. And then in the medical field, it is your patient panel. It is the number of patients at your hospital. It is a slightly smaller scale, specific to the organization, working together in these partnerships, collaboration. Pracademics, this is an actual word. It's the use of research and practice. And so I can see these partnerships in terms of health and medicine, people working together to develop research that is translatable into real life practice, that is beneficial and helpful to individuals, real life application. And then healthcare practice, working together, we can do this in terms of care coordination and wellness coordination. And what is care coordination? That's the easier one to talk about because it's more widely known. Care coordination is about being able to provide information and resources to patients when they need it. So for example, if they need to follow a doctor's recommendation or a referral, they may have limitations in getting there. They may have problems in terms of transportation, language, access to prescription medication, and so on. It could be anything else as well. It could be like a domestic violence setting. It could be a place where they need assistance with finding out about babysitting, daycare. From a public health perspective, that will help them to get the care that they need in terms of meeting their physicians or specialists' recommendations for their next steps in improving their care. Wellness coordination is something that I look at in terms of my outside practice, my business practice, right? Looking at how we can look at those different dimensions of wellness and how I can provide those resources to individuals. And so that's something that I like to do, find the resources that they need in order to meet all of the different dimensions of wellness, whether it be occupational, it can be financial, it could be emotional or psychological, it could be all of those different features.
Thank you for listening to the Sisterhood of Limitless Living podcast. If you like what you heard, come and follow us and subscribe on iTunes or give us a review. Also, you can join us on the Facebook group, The Sisterhood of Limitless Living, or come visit me on my website, aprilmorenophd.com. Take care.